Hi everyone, Dr. Liz here. I'm running a replay of this episode, which was originally 312, because one of my lovely listeners, a woman from the UK, alerted me to the fact that there's a glitch in it. It stops playing at about 8 minutes. And when she said this, I realized this happened when it aired as well, and I thought I had fixed it, but apparently I did not. So here we go again. I thought I'd replay it because it's still wonderful information. Peace. Liz here. Welcome to the Hypnotize Me podcast. I'm glad you're here, glad you're listening and learning, and hopefully it will help you with your journey along the way. I am a psychotherapist with a specialty in anxiety, insomnia, and deeper emotional healing. Hypnosis is one of the tools in my toolbox that I use to help people feel better and to help people be better. I do work all over the world. Please feel free to reach out and contact me if you would like some help. I've been an entrepreneur for most of my adult life, built an award-winning company, sold it, and then focused mainly on my private practice. That gives you a unique perspective, especially my ability to work with people in business at all kinds of levels. Before I go, if you'd like to support the podcast, you can go and subscribe to the newsletter, and you'll get free hypnosis downloads that you can listen to immediately. Another way is to buy one of the downloads that I have for sale. I only have a couple up there, but they're good ones. They've stood the test of time. I made the decision to not run ads during my podcast because I really do see it as an act of service. I completely respect people who do have ads on their podcast, but it's just not my path. All right, everyone, enjoy the episode, and I hope to see you back here soon. Hey everyone, Dr. Liz here. The podcast has been on a bit of a break because I moved from South Florida, the Fort Lauderdale area, which is just north of Miami, to North Florida, Jacksonville, which is right south of Georgia. So it's been a huge move for me. I've been in South Florida 30 plus years. And so this was a big change I was making. So the last couple of weeks, I've been unpacking at my old house, unpacking in the new house, setting up the home office. I found it was quite echoey. So I had to order some acoustic tiles to put on the walls and carpet for the floor and try to make it to where it was not so echoey when I recorded. I really thought I might have to record in my closet, which a lot of podcasters do. That would not really be a problem, but it is more convenient to be able to record at my desk rather than the closet. So the interview today is with Dr. Navidi, who is a specialist in hypnosis for GI disorders, functional abdominal pain, IBS. We have a great conversation because I've been doing hypnosis for IBS, abdominal functional pain, reflux, those types of disorders for probably 5 years now, maybe 6, maybe a little bit longer than that. I'm not sure. It's not a huge percentage of my practice, but I definitely have people that come in for it from time to time. Right now, I'm all virtual, but in the past, it's been in person as well. But it's always an interesting part of my practice, and I love helping people that way. And his whole practice is focused on that. He has quite a large practice, and they see people in all 50 states, which is fantastic. And they see adults and children and adolescents, which is also great. I only see adults. So what a great resource. So we talk about all kinds of stuff during this interview, like what types of hypnosis to do and when to seek treatment with hypnosis. That's always a big question. When do you try that? Often it's when people have tried everything else. Sometimes they come in a little bit earlier than that. One patient I had is referred by the head of Stanford's clinic because it's such a reputable treatment, hypnosis for IBS. But often you'll run into GI specialists who just poo-poo it, who like quote unquote don't believe in it. And it's like, look, hypnosis is not a faith-based medicine. It is well researched. And someone doesn't have to believe in hypnosis for it to work either. So anyway, occasionally you run into doctors like that. The more knowledgeable ones typically recommend hypnosis as part of someone's treatment. I've talked way too long today, so let's jump into the interview. I hope you're healthy and safe. Peace. Hi, Dr. Navidi. Welcome to the Hypnotize Me podcast.
Hi, good to meet you. I'm glad to be here. I'm always happy to talk hypnosis with someone.
Yep, me too. Me too. It's always a fascinating conversation, I will say. So, we're going to just start with how you first became a psychologist and then also how you started doing hypnosis.
I was a microbiology major,
Really?
and then I did biotech work for a few years at a couple companies. I remember I was doing yeast exocytosis research. Yeah.
I don't even know what that is really.
I don't even think
You don't either.
I don't even think I know what it is anymore either. I think it had something to do with a vesicle or something. Anyway, um, luckily, I was about to go and do like a PhD in biochemistry because I just didn't want to be a lab monkey for the rest
Yeah.
of my life. You got to get your PhD. So luckily, I've got a wife that's a lot smarter than me, and she kind of sat me down and was like, "Look, you might want to consider doing something you actually really are passionate about."
Mm.
And she knew I was just constantly reading books about hypnosis, about
Mm.
psychology, and just practicing on anyone around me. So luckily I listened to her, and long story short, I shifted over and now I'm a clinical psychologist.
Wonderful. So I know for me going through grad school, I didn't actually discover hypnosis until, I don't know, like 20 years out of grad school, actually. So
Oh
it
wow.
sounds like for you, it happened before you went to grad school.
Yeah, it was interesting. If I when I think back, I think as a teenager, I found this like I just remember it was like this little black book, and it was
Hmm.
old school hypnosis, like really directive stuff.
Uh-huh.
Probably was written in maybe the 60s or 70s, and it was a family vacation, and I got all my cousins and my sisters together, and one by one, I just tried the stuff in the book, just just for the heck of it.
Hysterical, huh?
Yeah, just for the heck of it. And it worked on some and it didn't work on others, but that was probably my first experience with it.
That is
Um,
funny. Yeah.
yeah.
And did you go to a program that taught hypnosis? Like mine didn't even, there was not a class. I know there wasn't a class
No,
on it.
no,
No.
no, not at all. Not at all. In
Okay.
fact, my first internship, it was interesting. Um, I wasn't like the supervisor, he actually was trained in hypnosis and told me that I wasn't allowed to do hypnosis.
But yeah, probably. Right. Because there's
Yeah.
all kinds of regulations around it for
And I mean,
psychologists. There's actually
I was
more for psychologists than there are someone who doesn't have a degree. Yeah.
Oh, yeah, yeah.
Yeah.
Someone who doesn't have a degree can just do a weekend training
Yep.
and like put out a shingle.
Right.
Um, but no, so I got involved with the American Society for Clinical Hypnosis,
Hmm.
ASH.
Ash. Yeah.
I saw that you also
Yeah.
have been associated with them, and they do
Hmm.
some great training.
They
And
do.
so I was doing as much ASH training as I could, and I still do.
Hmm.
Um, So I think they're a great organization.
They are. And for the listeners, they're a wonderful way to actually find a hypnosis practitioner. They have a tab on their website where you could find someone in your state, close to you, probably, depending on where you are. But yeah, they're a really good resource.
Yeah, they
Yeah.
are. They are.
So then how did you start specializing in IBS?
Yeah, it was an ASH training, and I wish I remember the name of the guy. He worked out of NIH,
Hmm.
and he did a talk, and at least part of the talk was on IBS,
Hmm.
hypnosis for IBS.
Yeah.
And at the time, I remember thinking, I'm never going to use this. Like,
Mm,
I wasn't really doing a specialty in health psych.
okay.
Um, but, I learned it. And then I had a patient that had responded already well to hypnosis
Mm-hmm.
and had IBS. And I said, well, you want to try this out?
Mm-hmm.
And they did. They knew I hadn't done it before. They knew I'd been trained. So I gave it a shot and it worked great.
Oh,
And
yeah.
that led to another and another.
Mm-hmm.
Um, and as I'm kind of doing it more, I'm learning, I'm reading as much as I can. I tried,
Yeah.
finding other trainings. And then the doctors in the area, the gastroenterologists start kind of knowing me and referring more and more patients.
Okay.
And before I know it, it's like 80% of my practice.
Wow.
That and chronic pain and
Chronic pain. Yeah.
you know, you just end up with a lot of complex medical cases.
Yes.
And throughout it, I kind of developed my own way of doing it.
I was
Um,
going to ask you,
yeah.
did you start out with the Powelson protocol, or one of
I
the Manchesters, or
No,
no? No, you
I
didn't.
didn't.
Oh.
I didn't. I just I kind of learned some of the principles from the training I did and
Uh-huh.
then just kind of came up with the rest on my own. And that's, I mean, I believe in learning the right way, but my personality is I always kind of come up with my own little twist on things, you know.
Creative then. It's a creative process.
Yeah, very much so. It's very in the
Yeah.
moment,
Hmm.
kind of adapting things. But that's just my personal style.
Yes, I have a mentor who, when I first started doing hypnosis, I actually met him at a conference, Florida Society of Clinical Hypnosis, which is
Yeah.
a state subsidiary of ASH, which we just talked
Mhm.
about. And funnily enough, it's called FISH, right? Like for Florida. But I met him there, and he quickly asked me, he's like, what happens when you read a script? And I said, I almost always end up changing it somehow. Like I can never read
Oh
a
yeah.
script like
Yeah.
completely as it's written all the way through. He's like, okay, so that means like you're more on the creative side, like it's a creative, intuitive process. And he really
Yeah.
affirmed that. That's okay, that's actually a
Mhm.
really beneficial process because in his perspective, you're tuning into the client. That's what you're doing and what that
Yeah.
client really needs. And I do the Powelson protocol, which is a protocol for the listeners developed out of
Mhm.
University of North Carolina, Chapel Hill. There's a lot of
Yeah.
research on it out of the medical school there. So they even took tissue samples of the bowel for the hypnosis versus the non-hypnosis group, and the bowel tissue changes, which is amazing. Like
Yeah.
I don't even understand how all that works really. But I know it does. And
Yeah.
so I definitely use that protocol. But at the same time, I've had many cases where I adapted it to really what the client needed and is going through, and for reflex as well. So
Yeah.
it started out strictly for IBS, but I think they even did research about adapting it for reflux and had incredible success with that. Like people
Yeah.
who are not eating anything, like felt like their diet was so limited, able to eat chocolate again and have coffee and spicy food. I remember one client who she emailed me later in the week. This is after working with her for a while, a couple months or so. And she said, I had Thai food. I'm so excited. And then, like, it's amazing the difference it can make for people. I'm sure you have similar experiences for that.
Yeah. So at a certain point in my career, I had this specialty and I realized I'm in the DC metro area and
Uh-huh.
there's nobody else on an outpatient basis
Oh,
who
really?
could um, see kids and adolescents
Hmm.
uh, GI with GI issues and knew
Hmm.
how to use hypnosis. Like put those three together, and there
Oh,
was
yeah.
nobody there. Yeah. And actually, by the way, I helped found the Northern Virginia chapter, which
Oh,
which
awesome.
one which once I guess eventually they've kind of broken up, but it was after I stopped having time to really participate.
Yeah.
Um, so long story short, I eventually started this bigger practice, GI psychology.
Uh-huh.
Uh, and it goes by the same website, just gipsychology.com.
Mm-hmm.
And the whole idea was that there aren't enough people trained to do this kind of gut brain therapy.
For
And
sure.
so that's what we want to do. So I'm in charge of training. So
Mm-hmm.
at this point, I've trained maybe 15, 20 people on this stuff. I rely heavily on the Paulson.
Uh-huh.
I feel like it's a good like training wheels for
Yes.
people when they're getting started.
Yes.
Uh, and then as they get more experience, they can start modifying it and kind of
Mm-hmm.
going off script. But it's like a safe place for them to come back to,
Yes.
when they're unsure about something. And now Paulson has retired, but he's actually gonna work with us on a study. So yeah,
Awesome. That's
it's super
awesome. What's
cool.
this study going to be?
I think it's just looking at um, the results of his protocol like out in the wild. So not in a controlled like kind of
Uh-huh.
university medical center situation, but out in the outpatient world where things
Outpatient.
get more complicated. Yeah. Yeah.
Awesome. That's great. Great. Oh,
Yeah.
I'll be so interested to hear the results of that eventually. I'm sure it'll get published.
Yeah. With his name on it, of course,
I
he's
know,
got,
right? That's a nice hookup, huh?
yeah, it is. And he's such a nice guy. He's hilarious. If you ever get a chance to hear him speak, he's the
Hmm.
funniest guy and just really knows his stuff when it comes to hypnosis.
I did attend a like webinar of his, and yeah, he was excellent. It's always nicer when someone's funny during the presentation or relatable.
Totally.
Yeah, it makes it more tolerable. No one wants to sit through a boring webinar, right? Where someone's just
Yeah.
reading slides or something,
Oh, yeah. Those are the worst.
They are. Yeah. So how did you get connected with him? Did you just reach out?
Let's see. I think we were at I think it was DDW. So that's like Digestive Disease Week. It's like the big
Okay.
gastroenterological conference. And within that, they were having like a little side training for GI psychologists.
Okay.
And he was doing kind of this, he was part of a panel of like four people who were doing specific GI related hypnosis topics.
Got it. Okay.
And so that's how we met him. And then we just kind of kept in touch. And it was my business partner. She co-founded GI Psychology with me. She was the one that just approached him and started chatting, and it turned out he was interested in working together.
Great. Great. So you serve the Washington, D.C. area and you're doing in person, I'm assuming.
So if you're talking about GI Psychology, the bigger practice,
Hmm.
we're completely telehealth and we're in all 50 states.
All
Yeah.
50 states be part of SciPact, or we can do that with
So
hypnosis.
no. This is again my partner because she does the operation side of the business.
Uh-huh.
She figured out between SciPact and
Yeah.
then getting individual licenses
Uh-huh.
for states, she managed to cobble together all 50 states. So we're able to see
Wow.
patients
Incredible. So
across the
for the
country.
listeners, SciPac is a typically when you're licensed as a psychologist, you're licensed in a particular state, meaning like you cannot practice in another state. Each state has their own licensing. It depends on the state. Sometimes it's very difficult to get licensed in another state that you want to practice in. It's actually been a historical problem when people want to move. It
Yeah.
restricts them often from moving. So there was an organization that came up and said, "Hey, let's find a solution to this, and you can join this compact organization and it'll let you practice in other states without having to be licensed in that state." Now, hypnosis I've known is a loophole often in the licensing laws where
Yeah.
you can often practice in another state. Sometimes you have to register with them, do something like that, but it's not strictly like I can't do psychotherapy in another state that I'm not
Yeah.
licensed in, but I
Right.
could do
Right.
some hypnosis actually. So it's sort of a gray area there,
And
loophole.
for us, we're always doing our hypnosis within psychotherapy,
Yeah.
you know.
Yeah.
Um,
Mhm.
but you could do hypnosis outside of psychotherapy, exactly like you're saying.
That's true. Yes.
Yeah.
That's a fantastic resource. My own daughter, my 18-year-old, has some significant GI issues. And luckily, I
Yeah.
know someone who specializes in that, and she happens to be in Florida. But you are right. I live in a huge area, South Florida, Miami-Dade, Broward County, and
Yeah.
there's no one here that really does that. So that's an
Yeah.
incredible resource for people if you're
Yeah.
listening to this and either yourself or you have a kid who's going through it and you don't really know how to help them. So that's fantastic. Oh, so happy to hear that.
And that's the message that's why I'm doing podcasts and stuff like that. The message I want to get out there is if you have these disorders, and if you're talking about just IBS, 1 in 10 people have it. If you're talking about the broader, what's called disorders of gut brain interaction, or function, used to be called
Hmm.
functional GI disorders, which include like
Yes.
dyspepsia, nausea, vomiting,
Yeah.
all kinds of disorders. Um, 40% of people at some point in their life are going to have one of those disorders. So
Wow.
they are insanely common.
I did not know
And
it's that high. That's incredibly
yes,
high. Do you think it's the same in Italy? Like,
when you look at the worldwide
at the
data,
worldwide?
it holds true.
Wow.
It holds
Okay. You know how they always say like Italian diet so much better. Right? I'm like, is that a
Yeah.
function of being in the US or that's
And
worldwide data?
no, it's worldwide.
Wow.
And here's the thing, it's not really caused by so much what we eat.
Hmm.
It's caused by that interaction between our brain and our gut.
Yeah.
Now, we might have other problems because of what we eat.
Yes.
Uh, you know what I mean? But these aren't necessarily caused by the food that we eat,
Okay.
but they can be exacerbated by the food once we have one of these disorders of gut brain
Yeah.
interaction.
What do you think the underpinnings are?
I would say essentially, like the metaphor I use with a lot of patients is, if you had a computer, this would be a software problem versus a hardware problem.
Okay.
So someone with these problems is going to go into the doctor, and you probably know it from your daughter. They're
Mhm.
going to get checked out, they're going to be potentially scoped,
Yep.
and they're not going to find anything wrong
Hmm.
structurally.
Hmm.
But the problem is how the central nervous system is interacting with the enteric nervous system.
Hmm.
Now, who tends to get these disorders? Often it's patients with anxiety,
Yeah.
patients who have a history of trauma,
Hmm.
have a history or currently have an eating disorder, and then finally patients that are on the spectrum.
Yes.
Those are the four groups that get it more often,
Hmm.
even though more people than that can get
Of
it.
course.
Uh,
Yeah.
So if we think about that, I suspect that the fundamental underpinning of the problem is when we start to fear our own body's reactions
Hmm.
to things, right? There's a very frequent pattern that you see where somebody gets sick,
Hmm.
and then after they're done being sick, they still have symptoms.
Hmm. Yes.
And so what can often happen, I think, they call it like the PTSD of the gut,
Oh, I love that. So accurate too. I just want to say, like,
right?
yes,
Yeah.
love it. Yeah, my daughter is on the spectrum, and I know there's
Okay. Yeah.
overlap, between GI and she was diagnosed with gastritis. So they did scope
Hmm.
her and actually find something. But
Yeah.
it's the PTSD around food, around like, is that going to make me
Yes.
sick? Like,
Yes.
I don't know if I can eat
Right.
that. Like, yeah. And it can evolve into an eating disorder if
It
it's
can.
not really
ARFID
addressed.
often,
Yep,
if
ARFID.
you're familiar with ARFID, it's avoidant restrictive food intake disorder for
Yes.
people listening.
Yes, and these are
Um,
not people who are trying to lose weight by restricting their
nope.
diet.
Nope.
They are scared. They are scared to
Yep.
eat something because it may land them in the bathroom or make them sick, nauseous, vomiting, that type of thing. So they start to restrict what they can eat, and develop this very personal list of safe, quote unquote, foods. But then what
Yep.
happens is it evolves into like nutritional deficiencies if it's not really handled. And it's a hard one. You know,
Yeah.
I ordered the book, the CBTI for ARFID. And
Yeah. Yeah.
basically it says like, one, it's pretty much the only one on the market, okay, that's even written. Two, there's not a whole lot of research on it. And three,
Yeah.
they were like, well, we're shooting in the dark here, you know, like really.
And frequently there's, from what we've seen, there's two major paths to ARFID, right? There's
Mhm.
one is the sensory path. And you
Yes.
see this with a lot of patients on the spectrum.
Hmm.
They're very sensitive to textures and tastes and,
Yes.
you know, and they can develop ARFID through that route. Then the other route is the fear-based route,
Yeah.
right? They're afraid that it's going to cause some reaction in their gut, either pain or nausea
Yes.
or vomiting. Sometimes it's even combined with a metaphobia where people
Mhm.
have an intense fear of vomiting.
Oh, yeah.
Uh,
So
they can
hard.
develop similar problems.
Yeah.
Yeah.
Yeah. And I think with IBS as well, people start
Mhm.
to try to develop like, what can I eat? What can I not
Yeah.
eat? That
What's
type of
safe?
thing. Yes. Yeah. But
And
they,
the thing is, they develop all these like safe or unsafe foods, but most of the time, it's actually not the food.
mhm.
Because what'll happen is, and you know this as a psychologist, they're just having a bad day and they eat some pizza,
Yeah.
right? And so they're thinking, huh, did my stomach pain, was that caused by the pizza?
Right.
So then the next time they have pizza, they go into it with a little bit of fear.
Yes.
And guess what? That fear feeds down the gut brain axis
Hmm.
and causes more symptoms.
Yes.
And and so when they eat that pizza, they're getting more symptoms, and now they're sure that pizza is bad for them. So then every time they eat
Hmm.
pizza in the future, they do it with a sense of doom.
Yes.
They know they're going to have a problem, and it becomes this self-fulfilling prophecy.
Yes. Right. Or they stop eating pizza completely. Like,
Oh, well,
you know,
yeah. Then you just
like, I'm
can't
not
get them
eating
to
the
eat
pizza.
pizza at all.
Right.
Yeah, it's just not happening.
Yes. Yeah.
Yeah.
And part of the hypnosis protocol for them is to help them relax around food and have them eat a more varied diet and one that's like satisfying to them as well. But it does
Yeah.
calm down all the symptoms. So how long do you typically work with someone before?
Yeah, so I would say that for me personally, it tends to be rather fast when we're treating the the GI issue. So if it's IBS or something like that. Like I've got a patient right now and they're responding well, and I'm guessing it's going to probably be around 5 or 6 sessions.
Yeah, it's
They can be
fast.
done with their DGBI. Um, the reason I like this work so much,
Hmm.
because sometimes psychologists look at me a little funny
Hmm.
when I say that I'm specializing in this. But what I really like about it is it's not too hard to treat the GI issue,
Hmm.
but then you've got so much therapeutic trust and momentum
Hmm.
that you can also treat what's often an underlying disorder,
Hmm.
which might be anxiety, it might be depression, it might be trauma.
Yeah,
But there's such a good relationship there that it's easy to get that treated. And often they might not have been willing to get that treated before
true.
um, they got that help for the GI problem.
Yeah, very true. Very true. I love that. It's a very nice way to put it. And are you
Yeah.
seeing them on a weekly basis, every other week, or is it really individual?
I typically will try to see them weekly when
Hmm.
they start. But if, sometimes people for finances or schedule, they need every other week.
Hmm.
And I think that's fine. I don't like to go less than that.
Yeah, me
Um,
neither. Yeah. I won't actually do
because
it if someone wants less
yeah,
than that.
it's
Yeah,
it's hard to get momentum
it
when
is.
it's that far apart,
Hmm.
3 weeks, 4 weeks, things like that. Yeah.
Yeah, yeah. I mean, when someone's been in therapy with me and they feel like they're well on their way and
Yeah.
they want some maintenance, then occasionally I'll do that, but I will not start that way. Yeah, there's not
Yeah.
enough momentum. It's like taking a quarter of an antibiotic and expecting it to work, you know?
That's a great metaphor. I like
Yeah,
it.
yeah.
Yeah. But related to that, when we look at the data from our clinic, because we've got 10 therapists
Hmm.
now trained up, I'd say the average for like something like IBS is around 10 sessions,
Okay.
like 10 to 14 sessions,
Hmm.
because I think what happens is often there's something else pops up,
Hmm.
right? Like you're treating the IBS and they're like, hey, these panic attacks are really bumming me out. And so you might do a session or two, help with that, and then go back to the
Yes.
GI,
Got it. Are you
and
recording the sessions for them? Like, do you send them home with a recording or?
yeah, so I would say the majority of our therapists, they will record,
Hmm.
um, and they'll send them with a recording. I don't always record, because some of my hypnosis sessions are not well adapted for that.
Yeah.
Meaning, I like to sometimes do a very interactive hypnosis
Hmm.
where I'm talking to them throughout, or there's ideomotor signals or something like that. That doesn't really lend itself to being recorded and repeated.
Correct. Yeah.
Um,
Agreed.
but often, like, we'll find out something that works for someone and it'll be very interactive. And then the next session, I'll do another version of it without any interaction,
Hmm.
just doing the thing we know worked.
Hmm.
And then we record that and we give it to them.
Okay. Got it. So when you're doing the more interactive session, what are you exploring?
Yeah. So sometimes it's just something as simple as, let me know when you notice that cool feeling, in your stomach, or,
Hmm.
let me nod your head when, this happens or that happens.
Hmm.
Sometimes it's more, I would consider more advanced techniques, kind of like exploratory.
Hmm.
So we might be, like investigating how the problem started,
Hmm.
looking at internal emotional conflicts. Um, are you familiar with Dabney Ewan's book,
Yes.
Ideomotor Signals
Yeah.
for Rapid
I
Hypnoanalysis?
love that book. Yes.
Me
Yeah.
too.
And
I'm
I
a
actually
huge
saw
fan of that
him
book.
before he passed away. I attended a seminar
Really?
of his. Yeah.
Oh, I would have loved to meet him.
Talk about fun. I mean, it
Yeah.
kept you on the edge of your seat. And this was like a 2-day seminar of, we
Yeah.
start at 9, we have a lunch break, and we end at like 5 or something. And I mean, yeah, notebooks full of notes from him. He's incredible. He was
Oh.
incredible. He sadly passed away a couple of years ago. But yeah, his book is fantastic as well. Yeah.
It's so well done. And I've read a lot of hypnosis books, and it's
Hmm.
such an accessible book. He basically gives you a flow chart for how to do this really, um, some can be very complicated,
Yes.
nuanced work, and he gives you this great flow chart for how to do it.
Hmm.
And I love his acronym. I still use the COMPIS,
Yes.
COMPISS,
Hmm.
um, to, like, as exploring it. So for people listening, that it was originally developed, I think, earlier by another clinician named Cheek. I can't remember his full name, but they called it the 7 keys,
Hmm.
the 7 keys for psychosomatic disorders. So it's like internal conflict,
Hmm.
organ language, motivation, past experience, identity, I think self suggestion or suggestion, and then self punishment. I think
Yeah.
those are the 7.
Yeah.
And I love, and exploring that, it just blows my mind still, the stuff
Yes.
you find when you go in there and look for that stuff.
Yes, I usually use guides on my Kindle. And so I have his like 7 questions. And sometimes when I get stuck with a client, I will go to his 7 questions to ask that are asking, like, was this
Nice.
suggested by someone in authority?
Right,
Is
right.
this related to something in your past? Like, it is very
Mhm.
well laid out, but you're right. It
Yeah.
is more of an advanced technique of, um, and someone who's willing to do that work with you too. Not everyone's really willing to do that.
Yeah. And
I,
my philosophy is I like to start at the more surface level.
mm-hmm.
Like if we can solve this problem directly
Yeah,
with just direct suggestion, great. You're in, you're out, and
true.
you're
Yeah.
done. You know, it's for the people that don't tend to respond to those direct
Hmm.
suggestions in the way that they would like. that I often will then switch over to the more exploratory methods.
Yeah, same here. I'm always like, look, if we can get this, if you don't need the deeper methods, we don't do them.
Yeah. Yeah.
Let's start here. And then only if we need them do we go there. Yeah. So
Very
when
cool.
should someone consider hypnosis if they have a GI disorder?
So if they've got a GI disorder, they're noticing pain or nausea or something, of course, go to your primary care,
Mhm.
do the tests. And more likely than not, the test will show that there is not a significant structural component. And if that's the case, then I would suggest, reaching out to us, or reaching out to someone in your area that's trained in hypnosis and trained in working with GI.
Yeah.
Because not every person who's trained in hypnosis knows how to work with IBS or functional
Oh, yeah.
dyspepsia
No,
or
it's a small percentage actually who knows how to do
yeah.
that, who has the both.
Yes,
Yeah.
exactly, exactly.
Hmm.
And that's the thing. That's why we, created, GI psychology. It's so rare. Like literally, I think the latest numbers were there are 500 trained gut brain therapists in the world. There's
That's it.
probably more than that. Yeah. Maybe you could double that and be generous. Say there's 1,000 in the world, but
Still,
still,
that's not a lot.
that's not a lot. That's ridiculously low
It is.
compared to how many people have these problems.
Yeah, absolutely it is. So do
Yeah.
you ever suggest someone try apps first? Like there's the Nerva app.
Yep.
You do?
Well, it depends. I think Nerva is good. What they've done is solid. Simone Peters is the one who created their IBS section. She's in Australia and she knows her stuff, and they've done studies to show that it helps.
Hmm.
Um, I think apps are very limited.
Hmm.
They can't adapt. They have a really poor follow through rate.
Mm.
People tend to like do a few sessions and then basically like give up. um, and there's all kinds of like different limitations, but I think um, if somebody just wants to give things a try
Hmm.
and they want a low cost entry
Hmm.
into it, I think something like Nerva is a great way to start.
Yeah, I think the same thing, but the biggest limitation is that there's no way an app could customize to you what you really need.
Yes.
And so when you
Yes.
see a trained hypnotherapist specializes in
Mhm.
this area, we know how to do that. We know how to adapt to you.
Absolutely. And it's like it's going to be a while till an app can pace it too, like
Mm.
take a little longer if you can tell they need to go, you know
Hmm.
they need that extra time to kind of sink in, or speed
Yes.
it up if they're already where they need to be, like even just the pacing, and then using language that really resonates with them, and using metaphors that resonate with them.
Yes. So
um
true.
yeah.
Yeah. Well, you have given us some great information about hypnosis and GI disorders and some eating disorders too, ARFID. So I
Yeah.
really appreciate you being here today. Can you please tell people again how to find your practice and how to get connected and get some help if they want?
Sure thing. So it's just gipsychology.com. Really simple.
Hmm.
We've got a free 15-minute consult with a clinically trained person who will answer people's questions and
Hmm.
help them figure out if this is the right thing for them. Um, we're available in all 50 states. I didn't mention, this is pretty cool. We partner with all these organizations. So,
Hmm.
um, so we're partnered with Crohn's and Colitis Foundation and the American College of Gastroenterology, Georgetown in my area,
Hmm.
MedStar, Scripps on the west. So it's like probably about 20 different organizations. The Mayo Clinic, we're partnered with, and we're their kind of GI psychology support. Uh,
Fantastic. What about
yeah.
outside of the US? Like, do you take international clients?
So we haven't quite figured out. We've had a few patients over the years that were outside the United States,
Hmm.
but we haven't explored it as a general practice. Like we haven't
Hmm.
gone out and made ourselves available. but it seems, as far as I can tell, it seems to be a very similar problem outside of the United States too.
Yeah.
There just aren't a lot of trained people out there
Yeah.
who understand how to do this work.
Okay, got it. All right. Just
Yeah.
asking because I know people all over the world listen to the podcast. So I want
Oh,
them
wow.
to be able to have the resource. And I've worked with clients all over the world as well. I will say that like Asia and Australia is really difficult for me because of the time difference.
Really?
Yes, because you
Oh,
get into like 12, 13-hour time differences.
yeah.
But Europe, South America, yeah, that's all pretty easy. Yeah.
Yeah.
But thank you so much for being here and sharing your wisdom.
Oh, my pleasure. It was a real pleasure talking with you, and it sounds like we have a lot of very similar interests in terms of hypnosis and probably know a lot of the same people. I look forward to maybe meeting you in person at one of the ASH conferences once they
Yes.
start getting back to in person.
Yeah, hopefully we'll meet up sometime.
Yeah, that would be great. Well, it was a pleasure talking with you. Thank you.
I hope you truly enjoyed today's episode. Remember that you can get free hypnosis downloads over at my website, drlizhypnosis.com, DRLIZ hypnosis.com. I work all over the world doing hypnosis. So if you're interested in working with me, please schedule a free consultation over at my website, and we'll see what your goals are and if I can be of service to you in helping you reach them. Finally, if you liked today's episode, please subscribe to the podcast or tell a friend. That way, more and more people learn about the power of hypnosis. All right, everyone, have a wonderful week. Peace.
This podcast is not mental health treatment, nor should it replace mental health treatment. If you need therapy or hypnotherapy, please seek treatment from a trained professional.